Welcome, medical students, to today's lecture on the intricate topic of chronic pancreatitis. As future gastroenterologists, it is crucial for you to have a comprehensive understanding of this condition, its pathophysiology, diagnostic challenges, and management strategies. Chronic pancreatitis is a complex disorder characterized by the progressive inflammation and fibrosis of the pancreas, leading to significant morbidity and mortality. Throughout this lecture, we will delve into various aspects of chronic pancreatitis, from the role of inflammatory markers in prognosis assessment to the impact of genetic mutations and environmental factors in disease progression. So, let us dive into the depths of this fascinating topic and expand our knowledge base on chronic pancreatitis. Chronic pancreatitis is associated with significant inflammation within the pancreatic parenchyma. This inflammatory response often leads to the release of various markers, such as C-reactive protein, CRP, interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha. These inflammatory markers play a crucial role in assessing the severity and prognosis of chronic pancreatitis. Elevated levels of CRP, for instance, have been associated with increased disease severity and a higher risk of complications. Similarly, IL-6 and TNF-alpha have shown correlations with pancreatic tissue damage and fibrosis progression. By closely monitoring these inflammatory markers, clinicians can gain valuable insights into disease progression, prognosis, and possible interventions. In the section on genetic mutations associated with hereditary chronic pancreatitis, we will discuss the role of specific genetic mutations in the development and progression of the disease. These mutations affect genes like PRSS1, SPINK1, CFTR, and CTRC. For example, PRSS1 mutations lead to increased risk of premature trypsin activation, while SPINK1 mutations impair trypsin inhibition. CFTR mutations disrupt pancreatic exocrine function. Understanding these mutations is important for proper disease management and genetic counseling. Alcohol's harmful effects on the pancreas are complex and lead to chronic pancreatitis. Alcohol damages acinar cells, causes oxidative stress, and activates pancreatic stellate cells, contributing to inflammation and tissue damage. Understanding these mechanisms is important for managing alcohol-related pancreatitis. Autoimmune pancreatitis is a unique form of chronic pancreatitis characterized by immune-mediated inflammation. Diagnosis is challenging due to similar symptoms with other forms. Clinical criteria, imaging studies, serological markers, and histopathology are used for accurate diagnosis and proper treatment. In chronic pancreatitis, persistent and severe abdominal pain is a major concern. Understanding the mechanisms behind this pain is crucial for effective management. Pancreatic neuroplasticity, nerve damage, and alterations in pain processing contribute to pain perception. Targeting these mechanisms can improve patient quality of life. Oxidative stress, an imbalance between reactive oxygen species, ROS, and antioxidant defenses, contributes to the development of chronic pancreatitis by causing tissue damage and inflammation. Targeting oxidative stress with antioxidants or anti-inflammatory agents may improve treatment outcomes. Chronic pancreatitis can be caused by secondary factors, such as duodenal diverticula and sphincter of Oddi dysfunction. These conditions can obstruct the pancreatic duct and lead to the development of chronic pancreatitis. Management mainly involves endoscopic interventions to relieve obstruction and improve symptoms. Fibrocalculous pancreatopathy is a unique form of chronic pancreatitis prevalent in specific regions. It involves calcium and protein deposition in the pancreatic duct, causing strictures and tissue damage. Symptoms include abdominal pain, steatorrhea, and diabetes. Management includes pain relief and enzyme replacement therapy. Endoscopic ultrasound-guided fine needle aspiration, USFNA, has emerged as a valuable diagnostic tool in chronic pancreatitis. It allows for direct sampling of pancreas tissue and evaluation of its histopathological characteristics, aiding in the diagnosis and differentiation of chronic pancreatitis from other pancreatic disorders. Through USFNA, clinicians can assess the pancreatic parenchyma, detect the presence of inflammation, and even diagnose concomitant pancreatic masses or pseudocysts. USFNA also provides an opportunity for molecular analysis of the obtained samples, aiding in precision medicine and tailored treatment approaches. This minimally invasive procedure has revolutionized the diagnostic landscape of chronic pancreatitis, leading to improved accuracy and reduced reliance on invasive surgical interventions. Patients with cystic fibrosis, CF, are at an increased risk of developing chronic pancreatitis due to mutations in the cystic fibrosis transmembrane conductance regulator, CFTR, gene. CFTR mutations result in abnormal pancreatic exocrine gland function, leading to mucus plugging within the ducts, inflammation, and subsequent fibrosis. Managing chronic pancreatitis in CF patients poses unique challenges, including the need for early detection through specialized screening tests, such as fecal elastase testing, and tailored treatment options. Pancreatic enzyme replacement therapy is of paramount importance in alleviating malabsorption and ensuring adequate pancreatic enzyme activity. Additionally, close monitoring for complications, such as diabetes mellitus or pancreatic pseudocysts, is essential for timely intervention and optimal disease management. Research suggests a connection between gut microbiota imbalance and chronic pancreatitis. This imbalance, known as dysbiosis, affects host microbiota interactions. Potential mechanisms include translocation of bacteria, pro-inflammatory pathways, and impaired immune regulation. Therapeutic interventions like probiotics may hold promise in managing chronic pancreatitis. Research is underway to explore novel biomarkers that could aid in early detection, disease monitoring, and prognostic evaluation in chronic pancreatitis. Promising biomarkers include pancreatitis-associated protein, PAP, macrophage activation marker, SCD163, and specific microRNAs. These biomarkers have the potential to improve diagnostic accuracy and treatment decision-making in chronic pancreatitis. Chronic pancreatitis is a complex disorder with multiple causes and diverse symptoms. Understanding its underlying factors can enhance diagnosis and treatment. As future gastroenterologists, staying up to date on advancements will enable us to provide better care, improve patient outcomes, and further research.